Hi, class. Welcome to my presentation, summarizing my individual interest paper's main ideas and implication for strategic communication. In our very first week, Professor Schiffer asked us, what is strategic communication? Before we explored in depth the foundations, theories, and practices of the discipline, I responded to that week's discussion post prompt with strategic communication is defined as the purposeful use of communication by an organization to fulfill its mission. While we now more fully understand the discipline, my initial response still holds true at the core. Companies strategically develop communications for their stakeholders to fulfill their missions. To ensure that these communications are effective, companies must use promotional techniques to stand out from the competition while creatively attracting and engaging their target audiences. By engaging customers, companies can emotionally connect with these audiences to encourage them to buy the company's products and services, refer other consumers to buy from the companies, and to demonstrate loyalty to these companies' brands. However, while developing promotional communications to creatively connect with consumers, companies may not prioritize ensuring that the information in these communications is accurate, which could cause harmful consequences to the consumer's mental or physical health. Audiences who follow guidance or buy products based on inaccurate or unsubstantiated or misleading health claims from health and wellness companies may adversely put their health at risk. In my paper, I talk about promotional communications using the tactics of advertorials, press releases, and websites, as these tactics are spanning internal and external communications that are conducive to including inaccurate health claims. Also, I focus on the digital forms of each tactic, as new information technologies are regarded as fundamental means to support people in their search for and elaboration of health information. First, there are a few reasons that audiences may be prone to believing advertorials, especially if they're appearing in what might be considered less legitimate publications. They may mislead audiences because they look less like ads and more like editorials to break through advertising clutter. Although the law requires proper labeling, they aren't always labeled at all or clearly labeled. They feature a greater amount of product information. With one-sided and simplistic portrayals of the featured products, audiences may believe that the product will solve their health issues. Organizations often issue press releases to attract media attention. Because the degree to which press releases are and should be promotional is still open to debate, companies with a rather explicit tendency to include and intensify positive evaluations to build media reputation and attention may, whether advertently or inadvertently, include misleading claims. In fact, in the health and wellness industry, according to one study, 40% of academic press releases contain exaggerated advice, 33% exaggerated causal claims, and 36% exaggerated inference to humans from animal research. These inaccurate representations of scientific studies may mislead the public, negatively affecting health decisions. More consumers than ever use websites to find information about medical conditions and treatment options. Americans who search symptoms or diseases online may come across well-sourced health information on websites such as WebMD or Healthline, but they may likewise turn to the highly ranked search results and social shares of websites with names such as Green Med Info and Healthy Holistic Living, which present themselves as authoritative reference guides on health topics while relying on false claims and misrepresented sources to promote alternative medical treatments. Another way that health-related websites may mislead consumers, whether intentionally or unintentionally, is by featuring links that apparently attribute the source website's health claims to third-party websites' factual information. Medically inaccurate or misleadingly presented websites may provide information or guidance that ultimately cause physical or mental harm. The Federal Trade Commission addresses deceptive promotions in coordination with the U.S. Food and Drug Administration. For promotional health-related claims to comply with regulations, companies must support their claims with solid proof, especially for foods, over-the-counter and prescription drugs, dietary supplements, medical devices, and other health-related products. Despite these laws, companies still make false or unproven claims. Just to give you an idea of current health concerns and complaints, this website shows the various health concerns publicized by the FDA. As you can see, there are a lot of them. And then this website shows actual health-related claims filed with the FTC, which includes many different types of dietary supplements and medical devices, for example. So despite governmental agencies' efforts, companies still make untruthful health claims leading to negative health consequences for consumers. I'll now go into real-world case examples that illustrate the prevalent presence of inaccurate, unsubstantiated, or false health claims in promotional communication to demonstrate the real-life risk that these promotional communications can pose to human health. Due to the increasing competitiveness of their market, infant formula manufacturers make promotional claims such as fosters cognitive development and supports digestive health without data to support these claims. But these claims may mislead parents into thinking that these formulas are equivalent or superior to breast milk, which actually provides several science-based benefits, including important antibodies and reduced disease risk. If manufacturers' claims confuse parents into thinking their formulas are superior to breastfeeding and breast milk, the parents may unknowingly deprive infants of important health benefits. AstraZeneca said its vaccine was 79% effective in its large US clinical trial, when independent monitors had seen that an additional month of data put the effectiveness at 69% to 75%. By releasing data in the press release that was the most favorable versus the most complete, the public may have chosen to avoid the vaccine, potentially leaving them vulnerable to COVID-19 infection. A third example is dietary supplements. The use of nutritional supplements is fueled in part by the belief that they can ward off chronic disease, including cancer, although several expert committees and organizations have concluded that there is little to no scientific evidence that supplements reduce cancer risk. To the contrary, actually, there is now evidence that high doses of some supplements increase cancer risk. Unfortunately, insufficient government regulation of the marketing of dietary supplement products may continue to result in unsound advice to consumers. As the popularity of using wearable sensor technology to increase physical performance, assist recovery, or monitor health has grown, manufacturers of these devices have made aggressive and exaggerated promotional claims not backed by scientific evidence or verified independently before their product launches. Without such evidence-based promotional claims, it's logical to deduce that wearable technology may be unsafe for consumers. And finally, in 2012, Janssen Pharmaceuticals promoted risperidone for unapproved uses such as dementia in elderly people. Since then, studies have shown that risperidone actually increases the risk of death for older adults with dementia who take medications for mental illness during treatment. Risperidone may also increase the risk of stroke or mini stroke for older adults with dementia during treatment. These consequences depict dire cases that may result from inaccurate health claims. By acknowledging that poorly supported health claims across different types of promotional communications developed by companies to stand out from the crowd and gain buy-in to their brand are a concern deserving great attention, strategic organizational communication practitioners and their target audiences can make a greater effort to verify that promotional communications include only accurate, substantiated health claims that comply with legal guidelines to prevent and avoid health-related consequences. Here are my references. Thank you so much, Professor Schaefer, and everyone in the summer 2021 session of COM 60111 Seminar on Strategic Communication. I learned so much from all of you throughout the course and hope to connect with you again in a different class.